Well, hay fever is a disease mostly affecting the eyes and the nose, and it was first described about 1819, so years ago, by John Boscott. Initially, it took him about 10 years to find enough cases to report it. Compare that today, when we all know somebody who has hay fever, and it's caused by inflammation in the nose and eyes, and the medical term is allergic rhinoconjunctivitis, literally nose eye inflammation. No, you're not born with hay fever, although you may be born with some risk factors for developing it. For example, if your parents are allergic to some foods or have eczema and asthma. The immune system is a blank canvas, and it makes antibodies to the proteins it's exposed to in the environment. The body makes normal antibody responses to the viruses and bacteria that it encounters. But in allergies, like hay fever, the immune system makes an inappropriate antibody called IgE to the pollen. And the antibodies, a bit like flags, when antibodies recognize specific proteins, they wave and attract the attention of other parts of the immune system. In infection, this allows the body to overcome the infection, where the antibodies see the pollen proteins, they respond as though there's a local infection, and this response causes the swelling. There's also some suggestion that being born in this winter or spring increases the risk of developing hay fever, perhaps because your exposure to pollen during the first 6 months of life. Well, it's rare to develop hay fever under the age of 3 years. The first years are spent developing antibodies to the pollen, probably, and making developing that response. Usually, the patients I see when they're starting to have really quite difficult hay fever is about the age of 8. But some children's disease gets worse and continues to worsen year on year until their late teens. And it can develop at any point during that time. Some people peak at the age of 8 or 9 and then seem to settle down. You will know if your child has hay fever because they will have symptoms of a runny nose, a blocked nose, and an itchy nose. It's slightly paradoxical that the nose is blocked and runny at the same time. Red and itchy eyes, which are watery, and sometimes you get other symptoms as well, like an itchy ears or itchy throats and headaches. And quite often children describe sleep disturbance during the hay fever season. More significant cases can sometimes have swelling in areas around the eyes, giving a puffy appearance. These are sometimes called allergic shyness. And sometimes the chest can also be affected with wheeze and asthma type symptoms during the hay fever season. For hay fever caused by pollen, these symptoms are seasonal, so they usually peak at the big early summer, June time. But some people may have all year round symptoms from other allergens, such as house dust mite or mold spores. So the first line treatment for hay fever is antihistamines. Most people with mild disease take a non-sedating antihistamine. The sedating antihistamines like Piriton or diphenhydramine, Benadryl, are not recommended, as these medicines cross into the brain and can cause drowsiness. And they may impair learning too for some children. The second and third generation antihistamines, such as cetirizine, loratadine, or fexofenadine, are preferred as they don't cross into the brain, and they also work for a little bit longer. For those with nasal symptoms, a nasal steroid can be used, and these are really effective if they're correctly administered. So it's important that you're trained on how to use the nasal spray and use it consistently. For those with eye symptoms, you can use eye drops, and there's two main types available, one called sodium chromoglycate eye drops, and also some antihistamine eye drops could also be used on top of your oral antihistamine medicine. Hay fever can't be prevented, but its course can be altered. And this is using something called immunotherapy. This has been around for 100 years or so and is commonly used in Europe and America, much more so than in the UK. This treatment works to teach the immune system to make different antibodies, IgG4 antibodies, to the pollen proteins. These new antibodies may compete with the IgE antibodies and redirect the immune response. The treatment is established in sublingual, which is under the tongue, and subcutaneous, which is under the skin preparations. And they're both methods of administration are similarly effective. Some sublingual immunotherapy is licensed and can treat allergy to grass, tree, and house dust mite. Treatment takes 3 years of daily tablets or liquid under the tongue, and the biggest improvement is usually seen in the first year, with a modest improvement in the second year, the third year to prevent further deterioration. Researchers suggested that there's no further deterioration over at least 5 years after the treatment is finished, but there's no longer studies to show whether this could be longer.